Hello, welcome back to Deconstructing with Dawn. I just uploaded my video of my August 2017 product reviews, my favorites and not so favorites. If you want to check that out, that's great. This here is more of about a medical update. I have 5 autoimmune diseases and a whole boatload of other medical ailments. Any one of them could kill you at any minute. But these 2 things that I'm going to talk about aren't necessarily life-threatening at this particular point, but they're a focal point of my life that is causing me some disruption right now. So I have watched a ton of videos, I've scoured the internet, I've gleaned as much information as I possibly can, but I thought if I would put this video out there, and if you know and can give me any advice about either one of these things, I'd terribly appreciate it. The first thing is Pseudo Tumor Cerebri, which I had mentioned in an update earlier in the winter. It was kind of a mixed update of the DNA medical. I mixed everything together because I just put it all out there. Anyhow, I think it was February. I was diagnosed with Pseudo Tumor Cerebri because I'm losing my vision. They have tried to find every which reason to blame it on something. And so the neurologist thought this is it. So they did 4 spinal taps, which was, and I'm telling you, I will never go through that again. But I was on the 4th spinal tap, finally got it, and I was diagnosed with this. Pseudo Tumor Cerebri basically means pseudo is fake, tumor, obviously what a tumor is, and cerebri is your brain. So my brain thinks it has a brain tumor, but it does not. It basically has too much pressure in it from fluid. Typically, a treatment, the symptoms are visual disturbances, extreme headaches, nauseous, like anything you could think of for having a brain tumor is what my brain thinks it's going through. And I don't have a brain tumor. At least as of February, I did not have a brain tumor. And my most common problem was, and now that I've developed my understanding of it, the things that I can blame on it are visual disturbances. However, my ophthalmologist is still not 100% certain that that is the problem, but visual disturbances. I have a headache every day of my life, and I have an extremely high pain tolerance. So with that, the headaches aren't a big deal. I don't even take Tylenol for them because they're just there every day. And so I didn't attribute that to anything until you don't have a headache one day, and then you're like, what the hell? I had a headache every day. Like literally, whatever. So in my case, it's pretty much the visual loss, the headache. I have this like whooshing sound in my ears at all times. In fact, I thought we had a train track by us, and we do. It's probably about 10 miles away. And every night I thought a train was coming through. And I'm like, finally at one point I tell my husband, I wish one night they just wouldn't have that train go through. And he's like, what are you talking about? There's no train. In fact, these tracks have not had a train on them in eons. Like they're like dead tracks. But I thought all this time that there was a train coming every night in my town, and there's no such thing. That's what kind of noises were going on in my head. So I started off with Topamax, which I knew from past experience with peripheral neuropathy, I was not a good candidate for Topamax. I told the neurologist that, but he said that's the first drug we're going to try. So I was on it for 3 weeks, which you get to the maximum dosage by 3 weeks, and I was on it for 3 weeks beyond that, and it was absolute hell. By the end of March, I thought I was going to die. It was a very unpleasant experience. I tell him that. I'm like, this is not, I told you it wasn't going to work. I had all the symptoms still. It wasn't helping. It was just making me incredibly bad. So he put me on Diamox. Diamox, I stayed on that from the end of March until just recently, about 3 or 4 weeks ago. And the Diamox, it helped. Like I stopped hearing the train anymore. The headaches weren't, like some days I didn't even notice I had a headache anymore. So it was working. However, it was making my fingertips tingle and my toes tingle. And I know that was a common side effect, but after months and months of use, I was supposed to have built up a tolerance, and it was supposed to go away, and it did not. Then I started getting these cold spot headaches, like right here on my head. It felt like a lake of water was there, and like somebody was just beating my head right here against water, like cold water. It was really weird. So I told the neurologist that, and he's like, okay, let's just stop. So I had to come into his office, reevaluate things, and he decided those are the two major drugs for that condition. I'm not responding well to either one of them, so we are going to do just plain old Lasix, which reduces your you know, fluid in your body, which in my case is incredibly dangerous because I have lupus and it has affected my kidneys. So Lasix affects your kidneys because you're peeing all the goddamn time. I'm not even kidding you. But you have to make sure you hydrate because you're losing so much of your electrolytes. Your kidneys are working their asses off, and it's incredibly dangerous. So in my case, if it doesn't significantly help with my visual loss and these headaches that are back and that kind of thing, then I need to stop Lasix. I have to have my kidneys checked every single month now, and which I get them every other month or so anyway, but it's really dangerous. So I don't know if there's anything else out there. I mean, obviously he's a neurologist, he would know. But if you have had personal experience with pseudotumor cerebri, please let me know what maybe has worked for you. I don't take any pain medications because most of them I'm allergic to, and what I'm not allergic to, it doesn't work on me. It just doesn't work. I have an incredibly high tolerance to pain, and that's the only thing that's getting me through this. Secondarily, I had uterine and cervical cancer when I was 29 years old. And polycystic ovarian syndrome. So at 29, so 2 months before I was 30, I had a hysterectomy where they took everything but my left ovary. And cut to 16 years later, almost, yeah, about 16 years, oh yeah, now, this month I think, 15 or 16 years, whatever. Anyhow, I am now in that time frame. I immediately went into surgical menopause is what they call it, and the doctor had left my left ovary hoping that that would produce hormones. It did not. It did not work. For a year I had to have HRT, hormone replacement therapy, just to try to level myself out. I was a raging maniac. Like, it was very bad. Plus I was, you know, 30 years old and menopausal, so not a pleasant experience, let me tell you that much. So only twice since that period has my left ovary ever been seen again. All studies afterwards, they couldn't find it. They could not locate it. And it is common for it to get absorbed into your body, scar tissue to form, and it can be hidden. But only twice it has shown up. Once it showed up about 5 years ago with a couple of cysts on something follicles. So yeah, I had cysts. So once again, back to being polycystic again. So the doctor felt, let's not do anything, let's just, you know, plus it's incredibly dangerous for me to have surgery. So they just said, just leave it alone, you know, it's no big deal, it'll probably absorb. And it did. And then it never was seen again until March of this year. I was incredibly bloated, and I'm fat, I get it, but I can tell when I'm bloated. I felt like a horse that had colic. I felt like I needed to be put down. It hurt so bad. And I had really bad abdominal pain. I kept going to the gastroenterologist, and he did every test he possibly could, and finally he did a CAT scan, and they found a mass on my left ovary. And so protocol with my insurance company, it's Kaiser in California, is to monitor. And again, it's incredibly unsafe for me to have surgery. So with that, they monitored it every 6 weeks. They have taken a new 2 different ultrasounds, an external and internal ultrasound, to check its size. It grew bigger, and then it changed and morphed where it became septated, which led towards ovarian cancer. But the doctor's like, let's just check it one more time, and if not, we'll get rid of it. And I'm like, I don't care what the answer is. I don't care what it turns into. I want it out, because it's only ever been a problem since it's been found, you know, since the hysterectomy initially. So cut to yesterday, I get a phone call, and I had the last ultrasound last Friday, a week ago today. He calls me yesterday, and it got bigger, and it's almost at about 6 centimeters at this particular point, which is not huge. I mean, people get them to 20, 30 centimeters. I have read 30 centimeters. Like what the hell? That's inside their bodies. But mine's only 6, like he said, a golf ball. So mine's a golf ball inside of me. But even that little tiny golf ball hurts like hell. Like I can imagine, if I was like the proper weight of 140, you know, for me, for my height, I can't even imagine how much excruciating pain that would be. Luckily, I've got some cushion here, and it's helping a great deal, but it still hurts like crazy. So we are a go for surgery on October 4th. He says hopefully, he's not anticipating that it is ovarian cancer, but because it has a thin septated wall as opposed to thick. Apparently a thick septated wall is worse than a thin, and the size is not perfect. So it doesn't look like it's a cyst. He's definitely calling it a tumor, and it needs to go on October 4th. So I have looked everywhere about statistics information about people that are post-hysterectomy for cervical and uterine cancer. And the only thing I seem to find is that you can still have migrated cells. Like if you had endometriosis, which apparently I did not know I had endometriosis before they actually got in there and removed all the scar tissuing, and she said it was an absolute mess in there. So some cells could have been left behind, and that's all I have been able to find, is that it could possibly, and it could just be a cyst, just be a blood-filled cyst. They call them chocolate cyst. Who knows what it could be, but it is in there and it's got to go. So I just want to know if anybody else has experienced having uterine and cervical cancer. They were both low grade. One was only a 1 grade on the uterine and a grade 2 on the cervical. I didn't even have to have chemo or radiation. It was just surgical removal, and that was it. But has anybody else experienced, ovarian cancer after those types of cancers, being left with a defunct ovary? So if you have experiences in either one of these situations, I'm reaching out for anybody that can help, or give me some information about that kind of thing and what your statistics, that if you found anything out, I would terribly appreciate it. So once again, I'm sharing way too much information with you guys, but y'all are my friends, right? Except for that one guy who's so mean to me, but otherwise the rest of you are just pleasant and lovely people. So thank you all. Have a beautiful Labor Day. We're not doing anything. My husband had surgery on his leg yesterday, so he actually made it to the football game to sit there and watch the crosstown rivalry game go on, but otherwise we're not doing anything for the weekend. So I hope you guys have a blessed weekend and be safe and sane.